Why 8 weeks ultrasound is important in future mother's life. 8 weeks pregnancy ultrasound is very important as all major body organs of the baby starts developing at this stage. Though every day of pregnancy is very important in future mother's life, week 6 has its unique importance. Here is every single detail of what can happen at week 6. Table of content. 8 weeks pregnancy, how big is your baby? Limbs and internal organ development. Nervous system development. Facial development. Ultrasound 8 weeks pregnant women. Why ultrasound is considered important at week 8. How the 8 weeks ultrasound is performed. 8 weeks pregnant ultrasound, what to expect? Do the week 8 ultrasound reveal the embryo? 8 weeks pregnant ultrasound heartbeat. 8 weeks pregnancy, how big is your baby? By week 8, baby's body organs are forming. In fact, the development phase is at peaks. Baby development can be seen in 8 weeks pregnant ultrasound pictures. Here is what is happening inside your womb in week 8. Limbs and internal organ development. By this week, baby at 8 weeks pregnant ultrasound, the baby is getting straighter, arms and legs are getting longer. However, thighs, knees, and toes are not yet formed, with the hands curled at the wrists and elbows. Baby's tiny tail is almost invisible at this stage. Tail is developed during initial stages, and the baby starts moving from this week. Baby's internal organs also start developing by this week. His heart divides into left and right chambers, developing distinct aortic and pulmonary valves. 8 weeks pregnant ultrasound also give details of baby's heartbeat. The baby may have heart rate of 150-160 times per minute, which is twice the normal heart rate of adults. At this stage, baby's pituitary gland, liver, and kidneys start forming. Baby's muscle fibers, cartilage, and bones start growing. Moreover, baby's liver starts producing blood cells and baby's blood type is determined. Nervous system development. By week 8, baby's brain and the nervous system started developing. The nerve cells branch out and get connected with each other to build a primitive neural pathway. At this stage, the taste buds and spinal cord of the fetus start forming. Facial development. Till 8 weeks, baby's facial features, such as eyes, nose, and lips, start forming and may get visible in later scans. Moreover, eyebrows and pigments within his eyes also start developing, which may give an open eye look. Ultrasound 8 weeks pregnant women. 8 weeks 1 day pregnant ultrasound photo. Why is ultrasound considered important at week 8? Week 8 ultrasound can be exciting as well as worry for parents in some cases. An ultrasound can provide a picture of what is happening inside mother's womb and how much the baby is developed. Many doctors conduct first ultrasound at week 8, and for many, it can be a very exciting moment for most parents. 8 weeks 2 days pregnant ultrasound. 8 weeks 3 days pregnant ultrasound. The ultrasound that is conducted at 8 weeks is very important as it helps to determine how the pregnancy is growing. 8 weeks 4 days pregnant ultrasound can provide following details. The first scan can give access to gestational age and provide details on fetus development. Week 8 scan helps to determine multiple pregnancies. 8 weeks scan can also help determine ectopic pregnancies and other problems. The ultrasound can help determine the health of ovaries and fallopian tubes. If the mother is bleeding, an ultrasound can help determine the reason. An ultrasound can help determine the size of the embryo, and check for the heartbeat. 8 weeks 5 days pregnant ultrasound. 8 weeks 6 days pregnant ultrasound. How the 8 weeks ultrasound is performed. All early pregnancy scans are performed transabdominally, through belly. However, from week 6 to 8 vaginal scans are conducted to get details of fetus development. Usually, doctors perform transbelly scans. However, to get accurate internal scanning they may conduct a vaginal scan too, which is considered safe for the health of the baby and mother. A gel is used before conducting the scan. Mother may feel a little cold. And the mother may feel some probe presses when the ultrasound handle is moving on, especially if her bladder is full. Normally it does not cause any pain. An ultrasound scan only takes 10 minutes to complete, and after the image is seen, the doctor will decide whether to go for a vaginal scan as well. 8 weeks pregnant ultrasound. What to expect? By week 8, your risk of having a miscarriage remains only 2% if the heartbeat is present. By this week, the baby may start making tiny movements through a scan, which is an amazing feeling for parents. And in most cases, fathers also join the doctor to see the images of ultrasound at 8 weeks pregnant mother. Do the week 8 ultrasound reveal the embryo? Yes, at week 8 the embryo development can be seen in a scan. 8 weeks pregnant ultrasound heartbeat? At week 8, baby's heartbeat is measured through the ultrasound. In case it is not traceable, the doctor considers that the pregnancy is not viable, and terminate the pregnancy. 2 options are used to terminate a pregnancy at this stage. Miscarrying naturally. Dilation and curettage procedure. Most women opt for miscarrying naturally instead of the D&C. Everything you need to know about pregnancy, of important for all pregnant women. Live healthy always. Conclusion. Conducting an ultrasound scan at week 8 is very important. It will help determine anomalies that must be diagnosed at early stages of pregnancies. In most cases, an early pregnancy ultrasound can identify issues that may cause harm to the mother or fetus or need to be treated as early as possible.